Next week I'll come up with something else. You know. All right, I'm joined today by Councilmember Cisneros and Councilmember Thomas, District H and District F. And then also Chief Acevedo, Chief Pena, and Dr. David Pearce today. Let me, as you can tell, as you can see, I'm wearing this mask today. The focus is on the census. And the reason I bring it up is that with all of the federal dollars, resources that we need to combat the pandemic, quite frankly, it's all tied to the census. And right now, we're at about 52.5, 53% in response. The average response in the country is a little over 60%. And we're at 52, 53%. And so I want to encourage people to take the time to respond to the census, 2020census.gov. Online, 9 questions, doesn't take very long at all. Or you can call. I don't have that number with me at this point, but I'll have it. So just want to say, today we will notice that, this Census 2020 mask, and next to keeping everyone updated to COVID-19, I just want to remind Houstonians of the importance of filling out your census form. And as of July the 5th, 52.5% of Houston's estimated 2.32 million residents have completed the survey, according to the most recent census data in Harris County. It's 9 questions. It takes only a few minutes. And for each person who goes unaccounted, Houston loses about $1,500, $1,500 per year in government funds for the next 10 years. So even a 1% undercount could cost the city of Houston $250 million in federal dollars for every 1% that we fail to count. And we need that money for education, housing, health care, and representation. So the census is critically important, especially when we are trying to fight COVID-19 and other pandemics that may come down the pike. Today, the Houston Health Department reports 412 new cases of COVID-19, bringing Houston's total to 26,012. Unfortunately, the number of deaths in our city are 5, bringing it to 250. And the 5 newly reported deaths happen to be a Hispanic male in his 30s with underlying health conditions who passed away on June 29th. A black female in her 50s with underlying health conditions, May 24th. A Hispanic female in her 50s, again underlying health conditions, June the 6th. A Hispanic male in his 50s, underlying health conditions, June the 21st. And a Hispanic male in his 70s, underlying health conditions, June 19th. So again, 412 new cases, 5 more deaths that we're adding to the list. The numbers are moving in the wrong direction for us. The COVID-19 virus in the city, quite frankly in the state, is out of control. And what we do today and over the next few weeks is critical to getting this virus back in a manageable state. And the goal for us is to bring the number of cases that we report on a daily basis. The goal is to bring that number down below 300. And I cite 300, that's the number I'm using, because it makes it then much more practical for us to engage with our contact tracing, okay? So we need all of these components to be working together. And so the goal for us is to bring that number that we report every day down to under 300 over a 7-day period. Okay, not just 1 or 2 days, And then that will help significantly in allowing our hospitals what they need to be able to handle any particular person that may need medical care. We continue to do robust testing at our 2 free testing sites in the city of Houston. The capacity is at 650 at each site each day, and both of our sites at Butler Stadium and Del Mar Stadium reach capacity, quite frankly, still around 12 or 1 o'clock, and we have to stop testing people. The ICU bed usage, again, we are now in phase 2 with regards to the Texas Medical Center. The next 13 to 14 days will be very, very important, and that's why it is highly important for us all to do our part to flatten the curve, to engage in social separation, to wear these masks. And as mayor, I will continue to ask people to stay home as much as possible, to work remotely, especially if you are sick, please stay home, or if you have underlying health conditions, please stay home. Wear a mask. Remember that many people who have the virus never show any symptoms, and that is why it is important that everyone wear a mask, so mask up. I want to talk about a new testing location we made mention that will be taking place on the east side of downtown in District H. And let me just bring up Councilmember Carlos Cisneros to talk about that testing site.
Yeah, this is very exciting news for the Second Ward. There have been requests for some time now requesting testing sites. We know we're hearing the data about the at-risk populations and the vulnerable communities in the Hispanic and neighborhoods. So all across District H, which is about 76% Hispanic, I'm hearing requests for testing sites, and I'm just so delighted to be thanking the Houston Health Department, thanking the Houston Community College System, and UMMC for coming together to locate a new site. Mr. Mayor, I'll call him Sylvester Turner did spill the beans yesterday, but it will be at the Felix Fraga campus, at the HCC campus along Navigation in Second Ward. It'll be one of the new sites that will be in place next week, beginning on Monday. So special thank you to President Melissa Gonzalez, who's been working with me for the last couple of weeks, and big thank you to Director Stephen Williams, who's been a close ally in making this happen too. I really appreciate that. And of course, we're grateful for the medical providers, UMMC. Thank you, Mayor. I look forward to having more sites too.
Thank you. And that's the HCC on Navigation. That testing site will start up on Monday. I want to thank Councilmember Carlos Cisneros. She was very, very helpful in communicating and working with UMMC and making that happen. She didn't quite say that, but I want to thank her, because without her support, that would not be happening. So thank you, Councilmember. And so that site will be available. It is important to mask up, to take this virus very, very seriously. I know District F has been impacted as well, and that's represented by Councilmember Tiffany Thomas. And so let me ask her to come forward to amplify the message for her people in the district.
Thank you so much, Mayor. The zip code 7736, 77072, and 77099 are leading the city in positives in District F. So historically, we've been known as the forgotten district, and I can tell the residents that are listening, we are forgotten no more. Working with the Houston Health Department, we will have a mobile testing site at Collins Elementary on July 18th. In partnership with District J, my colleague, Councilmember Edward Pollard, we want to make sure that those who do not have an access to a car, that they also will have walkable access to be tested as well. In addition, we're working with the city, the Houston Health Department, and Alief ISD to have mobile testing at Alief Crump Stadium. Just want to let you know that we're doing everything that we can to make sure you can be tested, have the PPEs, have the food, and the access to the information. More details to come. And so we're asking you to participate in the opportunity that we're offering. Thank you, Mayor.
So as you can see, this is an all-court press, okay? This is an all-court press throughout in our entire city, because that is what it's going to take in order to slow the progression of this virus. Now let me bring on Dr. Peirce to amplify that message. Dr. Peirce.
Thank you, Mayor. We can't underscore the importance of testing so that people know how to protect themselves. I just want to point out that the mayor reported an additional 5 deaths today, and we continue to hear about the deaths. And I'm also hearing people say that they don't understand why this is such a big deal, because there aren't that many deaths. So yesterday we talked about, don't forget all the people that are in intensive care units. I'd also like to point out, we have a slide I'd like to ask it put up, that there's a distinct possibility that there is an undercounting of the COVID-related deaths. In order for a death to be recorded as COVID-related, the death certificate needs to have something from the physician indicating a COVID-related illness, and then of course the process goes through, but that's how it gets recorded as a COVID-related death. If you look at this graph, and yes, it looks pretty choppy, but what you're looking at is the number of times per week, this is weekly data, that the Houston Fire Department responds on scene and finds somebody who's not breathing and doesn't have a pulse. Some of those are DOAs, and some of those are folks that we try to resuscitate. But week over week, usually you'll see where the orange line is 2 years ago, the gray line is 2019 last year, and the yellow line is this year. And you'll see the beginning in March, that line is going up and up and up and up. And so some of those are folks who are dying. Well, they're by virtue of the fact the fire department is being called, these are people who are dying at home, and then in many of these cases we're trying to resuscitate them, and in many cases they are already dead on scene and we don't attempt to resuscitate them. So there is a possibility that for those of you who are looking at the number of COVID-related deaths and saying, well, the number's not bad, it may very well be an undercount. And our colleagues in New York saw the same phenomenon. So if you look at New York City, the number of expected deaths that they would have had, and you add on top of that the number of known COVID-related deaths, and then you look at the actual number of deaths, it was even above that. So there's this delta of deaths that occur in communities that have COVID spreading that aren't necessarily being counted. So let us not for a moment think that because the number of deaths is small, any death is tragic. One is too many, we know that. But for each of those families, this is a life-changing event for the survivors. And everyone who gets infected with the virus, probably unintentionally, but was infected by somebody else. And we have the ability to stop that from happening. Wear a mask, stay 6 feet apart, don't go to large gatherings, and clean commonly touched surfaces.
Thank you so very much. And it's so important when people are, if you're not feeling well, please don't hesitate to call. Let me bring up Chief Aceveda to speak for the Houston Fire Department EMS. What did I say? Did I say Chief Aceveda? Well, you used to stand over here, and you used to be over here. Y'all confusing me. All right, Chief Pena, Fire Department EMS.
Thank you, Mayor. Good afternoon, everyone. So we are still dealing with the staffing challenges that we've been discussing, but the numbers are going in the right direction. Today, we're reporting 234 firefighters in quarantine. We have 79 that are positive for coronavirus. And again, that's a far cry from what we saw just 5 days ago, where we had over 300 firefighters in quarantine. So we're moving in the right direction. I want to take this time, Mayor, to voice how much we appreciate the hard work that our first responders, firefighters, paramedics, police officers, everybody on the front line is doing in response to this pandemic. But certainly, the work that our firefighters are doing is incredible. They're running over 1,100 calls for service each day, and they're doing it being extremely short-staffed. So I want to take this time and let them know how much we truly appreciate the hard work that they're doing each and every day. I also want to take some time to acknowledge our fleet maintenance personnel. They're doing enormous work in keeping our units in service, especially right now in the middle of summer with the heat and the issues that we normally face each year with our air conditioning, with our units out of service. They're doing an enormous job in keeping these units in service, and we appreciate their effort, and our firefighters appreciate the effort. In regards to the occupancy task force, Our inspectors and our arson investigators are still responding. Yesterday, in the last 24 hours, we had 71 calls for complaints, no referrals to TABC. Again, that's to the hard work of our inspectors and the cooperation of the business community. Again, we're working to provide education and voluntary compliance, to provide a safe environment for their patrons, and we appreciate their help in that. As Dr. Peirce mentioned earlier, we are seeing an increase in the number of DOAs that we're responding to. Just 3 days ago, we had the highest number that we've had all year at 18. 18 DOAs. That's people that we respond to 911 because they're having critical medical emergencies, and there is nothing that we can do by the time that we get to the scene. I want to stress to this community, do not wait to call 911 if you're having cardiac issues, respiratory issues, signs and symptoms of a stroke, any of those, call 911. Call 911. We have our ambulances are staffed, our fire trucks are staffed. We are there to respond. Do not wait too long, because this number and this data is not moving in the right direction. Those that have high blood pressure, diabetes, heart disease, any of those underlying symptoms, you are more susceptible, if you contract this virus, to a bad outcome. Do not wait to call 911. We would much rather we take you to the hospital where you have a fighting chance of surviving this than a tragedy of not making it because you wait too long to call 911. Okay, that's my report. Thank you.
Chief Acevedo.
Thank you, Mayor. Good afternoon, everyone. As of today, we have 219 sworn members of the department that are in quarantine. 165 of the 219 have already come back positive for COVID-19, and 54 are pending results. We have 17 of our civilian teammates that are in quarantine, including 13 positive and 4 pending. We have had 141 sworn members of the department that have been positive and have returned to work, and 7 civilians that are positive and have returned to work, for a total of 148. And since the beginning of COVID, Mayor, we've had 306 members of the department that are sworn members, 306 total that have come back positive, with 20 civilian members that have come back positive. We have 1 sergeant who's on a respirator, and we have 2 other employees that are hospitalized right now with COVID. So we would just ask everyone to just keep lifting them in prayer, and everyone in our community, extended community here in Houston, in prayer that is out and battling this disease. So thank you, Mayor.
And then lastly, I want to highlight another department, that's solid waste, because we have noticed some slowdowns on the pickups. I want to explain in part why. With respect to solid waste department, 73 employees were referred for screening. 21 have come back positive, which means that's more than 600 lost employee work days. All department programs, services have been impacted. Employees primarily are contracting this virus, not necessarily from the workplace, but from the community itself when they are away from the workplace. So that's 73 employees in solid waste alone that have been referred for screening. 21 have tested positive. So that is causing some slowdowns with respect to our pickup, and so we are having to supplement those services by using outside vendors. So I want to kind of give a perspective on that front. Again, it's so important to get on top of this virus. We got to do it together, collectively. Everyone is impacted, not just people who are infected by this virus, but people who are suffering from other conditions as well. So that's why we're all in this battle together, okay? You may not be suffering from the virus, may be suffering from someplace else, something else, but if we work together, we can get on top of it. Now, let me pause, and we'll take whatever questions or comments that you may have.
Can you folks, extrapolate on the undercounting of deaths and how much data you guys are still trying to evaluate, and just how many deaths there might be out there that we may not know about. The chart is, for the average person, a little difficult to look at, right? Can you simplify that a little bit?
So it's hard to answer your question. You start off with how many are there that are uncounted, and to be honest with you, we will probably never know. So let me explain to you what happens. If there is a person who has a chronic illness, let's say they're elderly, they've got emphysema and high blood pressure and diabetes, and they've got failing health, and they die at home, and now one is called, we get there, we may try to resuscitate them, or they may be that they've been gone for too long and they're not resuscitated. If there is a physician who will sign the death certificate, which in those cases there often are, they will not know to add COVID to the contributing cause of death because the patient had never been diagnosed. So those are the ones that will go uncounted. In addition, let's say with that patient, let's say we attempted resuscitation and then we brought him to the hospital and they were determined to, they couldn't resuscitate him in the emergency department. In that case, they may or may not get a COVID test. If they get a test, then we would know, but they may not get a COVID test. And the same phenomenon would occur where it may go uncounted because nobody knew. So this reinforces the point that Chief Pena made yesterday and again today, and I want to reinforce, is that you should not be afraid to go to the hospital. We are hearing, so I'm on call with the fire department today. I've already had a couple of calls, and I'm sure throughout the rest of the night I will have more calls of people where the firefighters are on scene, they believe this person needs to go to the hospital. They will get the physician online, and I will try to convince them to go to the hospital. And the number one reason I'm having this conversation with people today is they're afraid to go to the hospital because they're afraid that that's where other people with COVID are and that they might catch it if they go there. So here's the thing. The hospitals, this isn't the beginning of this right now, okay? The hospitals have become very good at protecting their own staff and patients. So there really is no reason for somebody who needs to go to the hospital to be afraid to go to the hospital. The hospitals, yes, there's a lot of people there with COVID disease, but there are also tremendous safeguards in place to protect you. So this graph should not be showing what it's showing. My fear is that increase, it can only be due to one thing, and that's due to the only thing that's new since March in our community from a health standpoint is COVID. So there's no reason to be afraid to go to the hospital.
And can you explain again, and forgive us for being repetitive, of why a lot of the tests take so many days to come back? It's because they have to get sent to Kansas or wherever. Could you explain that? And not all the tests come back at the same time?
Right. So it depends a lot on where the test is processed. So we have labs here locally that are processing samples that are obtained locally, and we generally get those results back pretty quickly within 2 to 4 days. In some of the larger sites, and including our 2 stadium sites, which are actually supported by the federal government, they have a contract with national labs, and the samples actually go to places like Lawrence, Kansas is one of them, and they get the process there. The answer, the test result, I should say, is then given to the CDC because it's a federal contractor, then gives it to the Texas Department of State Health Services in Austin, which then spreads it out locally to the local health department. So those are some of the reasons for the delays. And of course, much of this is being done in computer systems, which quite honestly were never designed to handle the load and the volume that they're handling today, and so we are frequently having computer glitches as well. And those add more delays.
Doctor, I have a question going back to the other question. You're showing us this chart here, and there are comparisons where you cite what New York has seen before. We're seeing in national media that there are comparisons between Houston, with national media reporting that it's starting to look like New York City before the peak of its COVID-19 crisis. Do you believe, with your perspective, is this a fair assessment, or is the national media blowing it out of proportion?
Well, I think that's up to us. Quite honestly, that's up to us as Houstonians. We can't change what's happened before today, but we absolutely can change what happens today and tomorrow. And so we don't have to be the next New York. If we wear masks, it's not hard. Put on the mask, stay 6 feet from people, don't have large gatherings, and clean commonly touched surfaces. That's what New York didn't understand what was happening to them as it was happening. We have no excuse. New York might have an excuse. Wuhan clearly had an excuse. They didn't know what was happening to them. New York may have got blindsided too a little bit. We have no excuse. As Houstonians, we're responsible for our own behavior, and we can't stop this. We are in control of our destiny.
At this point, though, do you feel that we are in a position where New York was at this point in time back then?
Well, I'm sure. I mean, our numbers, you're looking at the numbers just like the rest of us. We all see the numbers continue to rise. My point is they don't have to do that.
I want to just amplify. Now, if you take a look at, but from a pure numerical point of view, As of today, for example, I'm reporting 250 people who have died. Now, that's 250 too many. But we're not like 20,000 people in New York City. Okay, so understand Houston standards. We don't want one person, okay? And they don't want one person. But our numbers in terms of fatalities right now is 250. The number of cases that we're reporting is something over 20,000. Now, when you compare where we were at the end of April and May, our numbers were quite low. And so we have seen the exponential rise in the last 6 to 7 weeks. And that's what we're needing to stop. If we don't work collectively, okay, if we don't work collectively, then yes, the numbers will continue to go up and our healthcare system will become overwhelmed. And in that sense, we will be similar to New York. If our healthcare system becomes overwhelmed, we are trying to prevent that from happening.
Mayor, can you just talk about the GOP lawsuit and Stephen Holtze lawsuit? It's two separate lawsuits about cancellation against you and Houston First.
I have not necessarily seen the lawsuit. I've heard that Steve Holtze is their plaintiff.
There's two separate ones. There's one by Holtze and Jared Woodfill, and then the state's GOP, Republican Party of Texas, like half an hour ago, filed a lawsuit, basically similar things, saying you guys are out of not abiding by the contract or whatever. I mean, the bottom line is they would like to hold the convention in person here next week.
Well,
right?
the reality is in March of this year, they signed the contract that defined force majeure as a pandemic. They signed that contract. I have not read it, not seen it. They're certainly welcome to, I started to say to go to the courthouse, but I don't know if the courthouse is seeing people in person now. They were seeing people virtually. So it would be ironic if the judges are hearing those cases virtually. I know in federal court, they're hearing those cases virtually. So they're asking you to sit, and I believe the Texas Supreme Court has prohibited municipal courts, for example, from hearing cases, I think, until August the 3rd because of the pandemic. And so it's ironic that they're going to the courthouse that in many cases is hearing and seeing cases virtually to ask them to agree to allow 6,000 people to meet in person when even the judicial community, the United States Supreme Court, I believe, is hearing cases virtually. Now, isn't that ironic? I don't think I need to say anything more, but they are welcome to go to Montgomery County. Okay, I think Judge Keel in Montgomery County is more than happy to host the 6,000 delegates in Montgomery County, and I think they should go to Montgomery County. Other than that, I don't have anything else to say.
Mayor, the World Health Organization formally recognized today that the coronavirus can be transmitted indoors via aerosols or tiny air droplets. Will this acknowledgement change the protocols followed by the city and the population?
Yeah, so this is a big development with the they're leaning in that direction. I got to look at the exact paperwork to see if they've actually declared it, but I do know that the World Health Organization is leaning that direction. And so to the degree that we locally will have the ability to change rules or at least recommendations, we will do that. Part of it, of course, will depend on what the governor, what powers the governor has taken from us. And that, but it's absolutely part of the equation, and we will be adjusting accordingly.
Mayor, I know we've touched on people trying to get tested and being ID'd when it comes to taking the test for immigrants.
Yes.
And ever since that topic came up, we seem to be getting more and more phone calls about that happening. Do you think this could play a major factor on why a large part of the Hispanic community is not turning out for testing?
I think in part. I think people are concerned that they may be asked for identification. And I want to reinforce the message to all of the city of Houston's testing sites that we are not asking for that type of information. Immigrants are welcome. Whether you're documented or undocumented, you are welcome to all of the city of Houston's testing sites. Butler, Del Mar, the Houston Community College in Southeast, or the one on Navigation, the portable testing sites, mobile testing sites, I should say. So immigrant refugees, whether you're documented, undocumented, you're welcome, should not be turned away at all. And to the extent that is occurring, please let any of the city council members know or let me know, and then we'll make sure that we resolve those issues. But I certainly will reinforce that message with all of our providers for the city of Houston.
Where and how has COVID-19 spread on Houston's child care facilities or caretakers?
Along with the nursing homes, we've been focused from the health department standpoint, we've been focusing on child care centers and working with them to help them have the resources and the policies and techniques in place. So compared to others, we have had a couple of outbreaks at some of the child care centers, but they've been very small. And compared to other cities, we've done quite well. But that's only because we got ahead of the curve. We were in nursing homes and child care centers long before many other cities were. And so it is, but here's the deal, it's not over. Okay, so we are constantly going back and touching base and reaching out and making sure they have what they need. A child care center is not a health care facility, and so sometimes they struggle getting PPE, and so we're helping them make sure they get the PPE. They also have turnover employees. Sometimes their employees become ill, unfortunately, right? And so then they get new folks come in. So we got to make sure that we help them make sure their new people are trained.
Dr. Pearce, I have another question for you. We talked about re-sterilizing PPE. The White House task force said yesterday this was going to be a plan suggested to healthcare workers moving forward to recycle PPE. Is this effective strategy in your view? And if not, what are some safety concerns that come with reusing PPE?
So here locally, we've been recycling PPE through SETRAC, got the equipment in place locally, and we've been working with hospitals, and we've already been recycling PPE. The only thing that you have to keep a close eye on is that even though they've been re-sterilized, they are still products which can fatigue and fail. And so we've got a process in place where to make sure that, for example, the elastic bands don't get too worn out, they don't dry. And the sterilization process is a little rough on some of the materials. And so we've got a quality assurance process in place. So not 100% of the PPE that goes in comes out still usable, but those bases are covered.
I just had a question for the Chief Pena. I know you're saying you're doing a lot of enforcement. First of all, it was 18 yesterday alone on the deaths. Was that the number that you said in the news conference earlier?
Are you talking about DOAs?
Yes, yes.
No, a few days ago we had the highest, and that was 18.
Okay, a few days ago.
Yes.
Okay. My main question was for when you go out and do these enforcements by the state order, there seems to be a lot of, or there seems to be at least some people who are trying to kind of skirt the essence of the order. For example, they'll pack their, you can't close down a restaurant when the, patio's packed wall-to-wall people because outside areas are not contained. Do you feel like some of those efforts by some operators to skirt around the governor's order is impacting some of the enforcement efforts?
Maya, so when we show up to the scene, and again, we're a complaint. Okay, we don't have enough personnel to just go out and patrol. So we respond to complaints. When we show up to the scene, what we found is that overwhelmingly the business owners want to work with us to get into compliance, even on the external areas, right? As far as the providing the proper distancing, either rearranging furniture, moving. We do whatever we need to do to ensure a safe environment. We're there as a resource. And we've had to refer very few businesses to TABC for lack of compliance or just outright, just refusing to do any of that stuff. So does it happen? It does. When we show up, what we found, our experience has been that the business owners are working with us to get into compliance because I believe they understand the health crisis that we find ourselves in and what we're trying to do to ensure that we're tamping down this spread.
My question to Dr. Pearce, just a clarification question. You keep talking about and giving an explanation for the low deaths or mortality rates. And I think that is going contrary to what Professor Anthony Fauci is saying. First of all, when you keep saying what you're saying, it means that what we are getting out of treatment is not very effective. But I believe that the effectiveness in the treatment, the effectiveness of the work of the hospital is contributing to the low number of deaths that we are having. And we shouldn't gauge the success or number of deaths but basically what's happening at the hospitals, at the ICUs, and emergency. And then I think I'll leave it there. Thank you.
Okay, so if I understand your question correctly, I hope I wasn't misunderstood. The hospitals are doing an increasingly better job as time goes on in learning how to treat people with COVID disease. So that is contributing to a reduction in the number of deaths. What I'm trying to draw attention to today is the people who don't go to the hospital because they're afraid to go to the hospital and die at home, and therefore never avail themselves of those treatments. And in fact, I should characterize those improving treatments and techniques that are occurring at the hospitals.
My follow-up to that is the fetal-maternal transfer. We are getting information that there are children who are born with COVID, and they think that they must have gotten them from the mothers. So what advice do you have to pregnant women vis-a-vis COVID infections?
All right, so I didn't catch the entire question, but we know that there doesn't appear to be any vertical...
You want me to take the question over? He said he didn't get it, so let me get it.
One thing I do want to say is, another reason for people to not be afraid to go to the hospital is they don't need to be afraid to go to the hospital if they're worried about their immigration status. Hospitals don't care about that, all right? They're not going to ask you, they're not going to report you, they don't care about that. I've been involved in healthcare since I was 17 years old. I don't remember one time ever anybody in a hospital caring the least bit about anybody's immigration status. So do not let that be a reason to not go either.
Thank you, Dr. Peirce. I'm trying to recall how long I've been in the healthcare business. Dealing with this virus, you almost have to become, to some degree, knowledgeable of the healthcare business. All right, let me thank you all for joining us today, and let's work to bring these numbers down like the goal. Let's work hard to bring these cases per day down to 300, and then Maya, I know you asked, I think some of those people who file lawsuits, I think they've been proponents of lawsuit reform,
The TLR people?
Yeah, those people who filing lawsuits against the city, I'm so tempted to say something else, but I better stop. They're telling me to stop. Should I stop? They say El Terminado, the end. Okay, thank you all.
The mayor there setting his goal for the city at less than 300 COVID cases a day, new ones. Yesterday, 412 reported with 5 new deaths. The mayor revealing today, and one of those victims, a Hispanic man in his 30s with underlying conditions. So again, the mayor's goal, he thinks that the hospitals can handle 300 new cases a day for 7 straight days, and that will allow the city to contact trace those new cases as well. He says right now the numbers are going in the wrong direction and they are out of control. Some good news here. If you want to get tested, you've seen the long lines. There will be a 3rd city testing site opening on Monday, and that will be in the second east of downtown to the HCC campus on Navigation. So that will start coming up on Monday, a 3rd testing site. And you heard from the Houston Fire Department as well. Chief Pena saying they have staffing challenges, and they are seeing more folks die at home because they are afraid. They're very sick, but they're afraid to go to the hospital because they're afraid they'll catch coronavirus there. And in many cases, they already have COVID-19 and they pass away at home. They're seeing that much more than they normally do. So that's a big concern as well. We're going to break all this down for you coming up in less than 15 minutes. That's on the 411. You can stay in touch with us anytime by logging on to khou.com or downloading the KHOU mobile app. We will see you at 4 o'clock.
Price. To the dump, to the dump, to the dump, dump, dump.
Pipes. Repipe specialists will repipe your home in just 1 to 2 days at half the cost of a plumber.